Alright, today I'm going to show you what we do in the clinic for cervical disc type symptoms with patients. And so I'll show you each technique we're doing and then what we do for homework, or what we give them for homework to help them through during the days we don't see them. So first one I want to show you now, this is like the lumbar one, traction for the lumbar spine. We do traction for the cervical spine. And this simply gives that patient a bit of relief, because most people who've got disky-like symptoms, maybe they've been diagnosed, maybe they haven't, but they're the ones that the disc is sort of quite aggravated and maybe they're really locked up in the spine, a lot of spasm. It's really hard to get them moving. So usually what we try and do is actually just try and traction that spine a little bit, which means bringing the head towards me very gently, and so it's nice and safe and comfy on the back of the neck, and that usually gives a bit of gapping through the spine, which drops down some of that spasm, and listen, it gives them a bit of relief. Now as soon as they get a bit of relief, they're going to move a little bit more, then we can do more things with them. So with this one, I'm not pulling too much, just gentle sort of movement on here, and this one I'm gauging how much feedback I get from her or the patient of how much pain they've got, whether it's getting worse, getting better, and you're just trying to get enough drag that it gives the relief, not too much, just enough drag. Now sometimes there's a lot of spinal cord type sensitivity involvement, so what I get them doing, I'll just take that off again, is I get them bending their knees first. If you bend your knees for me, Claire, is then readjust my grip, get it as low down as I possibly can into there, and so that my palms are sort of snug underneath the back of the skull there. And so I'll drag some traction on with my arms. Okay, so I'm not really squeezing my hands because that's nasty. I just drag on with my arms, and then what I'm going to get it to do is slowly drop down one leg. So drop down one leg for me. And this straightens the spine out, which gets more drag. Drop the other leg down. And you can feel that more drag, right? You can feel that going now. And that gives them even more traction. So if the normal traction is not working and they've got a bit of sort of spinal cord sensitization, this helps them a little bit more. And again, we just do that for maybe half a minute, until they get that bit of relief, and then bring your knees up again, and then we be very careful that you just take it off ever so gently. And I do like 3 or 4 of those. Now of course we do all the mobilisation and prone, but I'm showing you all the supine ones today. Now this one is rotation. Now it may look like I'm about to crack a neck, but I'm not. So with this one I'm going to rotate it to the left. Now this might be good if she had left-sided symptoms, meaning pain going out the left-hand side, maybe it's down the arm, and we're trying to go towards that painful side. The key thing about this is that my right arm is giving her a bit of traction. This left arm is going to control what the head does. Okay, so this is the rotation one. This one here can give a bit of traction, but also I can work out which joint I want to help glide and mobilise. So it's almost a bit of a mulligan technique in a way, because I'm actually moving as I rotate. Now, some people are very acute, you can only move a certain little amount of distance, but if I can get on a bit of traction with it and then rotate them like that, it means that I can get the neck rotating without them doing it. So you just got to make sure that they're relaxed. Let it go again, because they tend to tense up a little bit until they're used to you. And this one makes sure you're not grabbing too hard. So it's a very nice sort of firm control there, and then a rotate that way. Obviously this is just a mobilisation with movement. There's nothing manipulative about it. And as they get better, you may find the range increases. So they might increase range, or the pain may get less. Obviously I don't want to go into the pain too much. And this is where we do this quite a few times and then reassess, see what their movement's like when they're sitting up again. So that's your rotation one. So that's going towards the painful side. With the disky-like symptoms, we sort of want to end up closing down that side. So if I was going to do a side glide, I'd come in from that side. So this one here, you swap hands, and this arm is now going to be the cradler, if you like. And you just got to watch that you don't put them in too much flexion. So this point here, I've now got my hand on her chin this way, but I'm not going to yank her chin. This is just to control how much movement I'm going in that side bend. This arm is going to be the mobiliser. So this one, I again contraction them a bit, side bend them, and then I'm going to add on a bit of rotation away, and then I can side glide them that way. Again, it's not a manip, it's a very much I'm trying to facilitate her side bending, because usually these people, they can't side bend. So I'm helping her side bend, getting those joints moving, which, you know, as long as you get the movement better, then that spasm tends to calm down. So this is not a forceful technique, it's a very slow, gradual movement, trying to get side bending better. Like I said, it's me doing the movement to try and get the spine moving, because when they do it, there's too much spasm going on. And this just helps loosen up the joints, and that helps them get slowly better. So that's your side glide. Now we're going to go through some retraction. Now, retraction is like doing extension for the lower back. Okay, so this one actually helps you improve disc pressures from the back of the disc and tries to move them towards the centre. So if you come this way for me, my dad, this one you've got to be careful that you've just got to hold that head, there's not too much spasm. I want you to come, Claire, right to the end of the bed. So this one, keep going, keep going. I want their shoulders right to the edge. Now this is a bit awkward to try and get them in this position, but in this position you've got to have a bit of a faith game. So this, my right arm is now holding her head and completely cradling, and this is the one that's going to be lifting up and down. This one here is going to be help gliding in the right position. So it's this movement here. I'm doing retraction, but I'm doing it unweighted in supine, so there's a lot less load through the spine and the discs, which is really, really comfortable for the patient. They've just got to trust you. So at this point here, I'm going to slowly glide that neck into retraction. Now, first of all, it feels like sort of a bit choky. Once they start relaxing and getting used to you, it'll start getting easier. What I like to do though with this, my bottom hand, is actually add on a bit of that traction we did before. And that traction there helps reduce some of that muscle guarding. Because if you can get in some of this movement, when they sit up again, because of those movements through that spine that they couldn't do before because they're in so much spasm, they couldn't do here, they're a lot better. And that just helps calm down the whole thing. Now as they get better, you can afford to go lower and lower and lower. Obviously don't hold it there, but this position here is really effective in trying to improve their retraction.